So we've done an interim analysis, even though we haven't completed, but we haven't unblinded the results. So just a quick background, the study aims were to compare wearing a standard watch with versus wearing a vibrating alarm watch, which would reduce their daytime wetting in the children that following a time voiding program. And our hypothesis was that the children would adhere better to the time voiding program when they're being reminded by their vibrating watch rather than the regular watch, and that children who had a problem with incomplete bladder emptying would actually be able to empty better after a successful time voiding program. And so the methods we used, we conducted a randomised controlled trial, or we are conducting a randomised controlled trial. We need a total of 360 kids to fulfil the sample size. We are recruiting children 5 to 13 years who have significant daytime urinary incontinence. They have to have had it for at least 6 months and have at least 2 wet nights per week to be eligible. And they are randomised centrally, not by, so the clinical trial centre, we randomise through them, they either go to treatment or control group. And the data we've been collecting, initially baseline data about their current wetting problem. We get them to do a quality of life questionnaire. We do a Euroflow and a post-void ultrasound. And then during treatment, they have to fill out a bladder diary for the 12 weeks, giving us information about whether they're wearing the watch, whether the watch helped to remind them to go to the toilet, whether they've been wet that day or not, and the severity of their wet. And then after that 12-week period, those who have been randomised to the control group, we actually do then switch on the reminders for them so that they do get to use the watch with the vibration reminders. And then we follow up the whole lot, a whole group of children for 6 months, and so they have 3 2-monthly questionnaires in that 6 months. And it's really interesting to see those who've been in the control group, the difference that may make by actually having the watch switched on for them. So our primary outcome is the proportion of children who get completely dry, so have a full response, and that's obviously 14 consecutive dry days. And the secondary outcome is the change in their frequency and severity of wetting, so whether they've actually had an improvement, and also the proportion, any change in proportion with post-void residual after their treatment. So this is data just up to the 1st of September. And we had, at that point, 336 referrals. And as you can see, some weren't eligible or they didn't enrol. They obviously were a bit overwhelmed by the paperwork and changed their mind, or various reasons the child decided not to do it. We've got 12 outcome pending because they're just either doing their run-in forms and they haven't been randomised yet. So of the 215 randomised patients, 108 in Group A and 107 in Group B. And as I said, we don't know which group is which. But if you have a look down the bottom here, because the trial's been running for a long time, there's only small numbers in the treatment group and follow-up. So most of them are actually completed at this point. And in both groups, we've lost some people, just cannot contact them, or we've had some withdraw because they either had some sort of health or major family trauma, so health issue or trauma that meant that they just said we can't cope with being in the trial any longer. So this is just a quick snapshot of the patient characteristics. So because we stratified by age, gender and severity of wetting, you can see that in both groups we've got very similar numbers of females, females and males, age and their severity of wetting is very similar. We can see there's a little bit of a difference in the frequency of wetting, so that's because that wasn't part of the stratification. But if you look down at the bottom of the post-void residual, kids who actually had more than 10 mils left in their bladder when we did their post-void ultrasound, there's a little bit a higher number in Group B. And our outcomes so far, so we obviously our primary outcome was this complete response. And if you look between Group A and Group B, so I should mention that we've only got 192, not obviously the 200 15. So these are the people who've completed, so the numbers are slightly less. So Group A had 92 and Group B has 100. But of those who've completed, it's very similar, the number who got completely dry. But if you look at the number who actually improved, we've got a higher number in Group B who seem to have had improvement. And in both groups, there's a bit of a problem for some kids, just it didn't make any difference for them. And of those who have completed, not quite all of them have had their post-void residual done. Sometimes it's really difficult to get particularly people from the country back to our clinic to do their follow-up visit. So we've got 88 in Group A and 98 in Group B who've completed their post-void residual at the follow-up visit. And we've still got some kids who have post-void residual. So if you look at those who had resolution of post-void residual after treatment, we've got a few, but we still have some that had persistent post-void residual even after treatment. And surprisingly, some seem to have new onset of post-void residual after or despite having treatment. So here in Group A seems to be quite a few who've had resolution. Oh, has that moved? I'm just trying to think if that's correct. Sorry, let me go back. I think that circle's in the wrong place. I apologise. I think that one should have been down here. So because this one is a higher number who had a new onset in Group A. So what we can learn so far from having done this interim analysis, that we've got pretty similar number of children who've had, pretty similar number who've got dry. Many did get improvement. As Petrina alluded to, we have had slow recruitment because we actually had the watch become commercially available after we started the trial. We've had a large proportion of children who had incomplete bladder emptying, and that's certainly more than we had expected, but partly that may be because in Petrina's clinic previously they'd always done it with bladder scanner. They'd look for post-void residual, but we've been using an ultrasound machine which is really quite accurate. Maybe we're just picking up a bit more. And so we really feel we need to continue with this trial and finish it so that we can really know for certain which watch is better at improving daytime urinary incontinence symptoms, and whether a successful time voiding program will actually facilitate resolution of their post-void residual. So if you note down the bottom there's my phone number, my email address. If you do have any children that you see that you'd like to refer to the trial, then please do, because we still have a few to go. So thank you for your time.